Okay. 3, 2, 1. Hey, what's going on, guys? Jerem Dastrup here with Dental Intelligence, and I have my good friend and colleague and absolute dental expert and professional, Katrina Sanders, aka the hygienist. And for those that don't know what that is, you need to look into that. It's awesome. I think she does a great job with constantly adding value in multiple different facets to the dental world.
Thank you.
You're going to feel a little bit of her passion. If this is your first video with Katrina, I highly encourage that you go back through our channel and look at a couple of the other videos that we've done and the content that she has provided, really just to shed light to each and every one of you. How we can have more fun doing what we're doing, how we can provide better patient care and an experience, how we can run profitable businesses, really entailed with how do we communicate better to each other as dental professionals inside of the practice and out. So this is a hot topic. This is one of my favorites. I do hear a lot. We hear a lot on this topic at Dental Intelligence, really because there's so much that it entails. There's good, there's bad, there's best practices. And so today we're going to dive a little bit into what are those best practices, really with the patient at the center of our success. How do we make sure that they're walking away with what's best for them? And PPO dependency is a big part of that. So Katrina, we'll turn it over to you. We'll roll up our sleeves and let's get to work.
Awesome. Thank you so much, Jeremy. I really appreciate it. And again, thank you so much to you and the wonderful team of Dental Intel for having me here. I love that this is one of your favorite topics. As a dental hygienist, it's not one of my favorite topics because I think we can all agree that when we talk about PPOs or third-party payers in general, that this is a sore subject for us. I can't tell you how many times when back before the world fell apart and I was traveling quite a bit, that I would lecture on the CDT codes and how to use appropriate CDT codes to diagnose. And of course, although this was really about doing the right thing for the patient, that I word kept showing up. People would raise their hands, but what about insurance? How does insurance handle this? What if insurance declines this? What if insurance denies this? And it really set me back. It made me realize that this is sitting at the core of a lot of what dental professionals are thinking about. And do you know, Jerem, that makes me sad because I think about being a patient myself. What is the number one thing that I would want a professional, a medical or dental professional to focus on? I would want their focus to be my health first and foremost. And so I think before we start talking about PPO dependency, I think we need a deep dive into who it is who's dependent on the PPO. And that means dialing it back. We're going to go back in time. We're going to, Emmett Brown's going to show up. We're going to get in his DeLorean. We're going to go back to the 1950s because that's when we really started to see some of these insurance entities start to kind of pepper in. Now, before the 1950s, and Jerome, I'm sure you've done the research on this, so you know, before the 1950s, people weren't really routinely going to the dentist. You'd go if you were in pain, right? In fact, even before dentists really branded who they were, people would get their dental work done by their barber. Now, I love the gal who does my hair. Julie's amazing, and she's really fantastic, but I would never trust her to extract my wisdom teeth for me, right? We have now specialized. We have evolved. And so what happened was dentistry evolved. In the 1950s, we really wanted to get to a place where dental hygienists were able to step into their role as preventive specialists, that doctors were able to diagnose decay when it maybe wasn't completely bombed out, where the patient was having a root canal done or their tooth was breaking, that maybe what we needed to do was, I don't know, create a culture shift in how society or how our community saw dentistry. Because for a long time, it was only emergency based. So here come the PPOs, here come the insurance companies, right? The insurance companies come along and they're saying, I got a deal for you. I'm going to offer this service and your patient will be able to come in, X number of times per year and receive preventive therapy. They can also get things like radiographs covered, or maybe even a portion of, advanced work done. And dentistry was like, sign me up. That's awesome. So what you're saying is you can help market for me, right? And so that's exactly what dentistry did. We signed up for it and we created this change where now when you are an employee of a large corporation and you go to the HR department and you select all of the different entities that you want from the accoutrements of your benefits, that you then know, now I can go to the dentist and get my free preventive stuff done. And I can probably get I get $2,000 that I can basically use as a punch card to, purchase all my, dental needs. But let's get back in that DeLorean after saving the clock tower and come back to 2020, 70 years later. And here's the deal. And this is going to be provocative, but you know me, Jeremy, I like to say provocative things. So
Yes,
here's
you
the
do.
deal. We still rely on PPOs. We still do. We rely on PPOs because if we're signed up with a PPO that we can use that as a marketing tool to bring patients, if we accept that PPO, into our practice. When the economy shut down in 2008, 2009, we all remember the day that happened when, the market just went insane and people were watching their 401ks get emptied. When we saw those changes happen, it was the few patients who did have insurance that were coming in and getting their bread and butter dentistry done that kept our lights on and kept our doors open. We use the PPO plan to send emails to our patients or newsletters to our patients at the end of the year saying, if you don't use it, you're going to lose it. So, by the way, we are dependent on PPOs. And in order for us to have a true conversation about, and I think the whole concept is, when I looked at this topic initially, Jeremy, I thought, well, yeah, it's a patient who's dependent on the PPO. And then I went, whoa, wait a minute. It's us. We're the ones that are dependent on it. Our patients are too. But in order for us to truly move past PPO dependency, we have to look at the things that we're doing, that we're leaning on those PPOs for. And we have to acknowledge that. When we talk about PPO dependency, are we using our dependence as a part of our energy when we're bringing our patients into our practice, when we're having conversations with our patients? And are we the ones that are sensitive to that particular dependency? And what I mean by that is this. When we have patients say things like, does my insurance cover that? So we've just spent this huge amount of time going through assessments, talking to our patient, getting out the intraoral camera, getting out we've been doing all these things, right? To educate our patients on the fact that they need this procedure. And then they come back with, does my insurance cover that? I think the problem in dentistry is that what we hear is, I won't accept treatment unless my insurance provides coverage. And I don't know why that is, Jerem. I mean, I have a thought that on our graduation day that we put this like little hearing aid in our ears and for whatever reason, when a patient asks about insurance, that immediately that filter takes that message and changes it. And so in our heads, what we hear is, I'm not going to do it unless my insurance provides coverage, which I will say, and Catherine Belt, Catherine, isn't she amazing? I
Amazing.
love that woman. She says that there is always going to be a small sliver of unreasonable people. Like, no matter what, they're going to be unreasonable. And sometimes I feel when we look at a program like this, we're thinking in the back of our head to that pain in the butt patient that came in on Tuesday at 9 a.m. and threw a big stink about his insurance. Well, we can't cater our practice to the pain in the butts. Because if we do, then we are creating an issue where the patients who are good patients in the practice are not getting the care they need and deserve.
Hmm.
So the reality for us is most of the time when a patient is simply asking, does my insurance cover that? They're simply asking because they want to know. Rather, they're not saying, I refuse this treatment unless my insurance provides coverage. One of my favorite statements is really talking specifically about how it is that you explain a procedure to a patient. Now, I'll give you an example, fluoride varnish, because that's an easy one. I see a patient as a practicing hygienist. They're sitting in my chair. They have exposed roots. They do have some sensitivity when I'm using my Cavitron. And this particular patient, as I'm talking to them, I'm saying, I am concerned because you have exposed roots. Those exposed roots do not have hard enamel to cover the root. And so it makes it that much easier if you get bacteria onto those areas for the bacteria to destroy your cementum, which is kind of a weak layer of your tooth structure. I'm concerned about those areas. What I would like to do today, notice I did there, what I would like to do today is place a vitamin-rich layer of fluoride calcium ions onto the root surface. I'd like to paint this throughout your mouth, and this is a full mouth procedure. I don't know if your insurance will cover this or not. Unfortunately, we can't I can't guide my clinical decision making. I can't tell you, that you don't need to have this because your insurance doesn't cover it. Unfortunately, I don't know if your insurance will cover it or not, but the out of pocket in the event your insurance doesn't cover it is $35. Do you know how many times after I go through the whole thing and then I say the fee, the patient's like, oh, well, let's just do it.
Okay, yeah, whatever.
Right? It's like, I always tell women, it's like when you get your nails done at the nail salon and you want like a design and they're like, that's $5 extra. And you're like, I don't care. I just want a cute flower. Do it, So patients, they really don't mind, Jeremy. And I think that's the important thing for us to be mindful of. Now, a few warnings that we need to look for within our practice. Number one, the new patient phone call. Now, I've done a lot of, and I know, Laura Hatch does a lot of these too. She's wonderful as well. We do a lot of like secret shopper calls. You call in, you pretend to be a new patient into the practice. And I cannot tell you how many times, even before my name, dental practices are asking, are we working with an insurance company today? So before you even learn about who I am, before you even learn my name, how I heard about the practice, before you learn about why I'm calling to schedule an appointment, your number one concern is if I'm dealing with insurance or not. And I understand why we do this. We do this because if the patient doesn't have insurance, or if maybe we don't accept their insurance plan, then we've wasted our time on that call. But maybe you haven't. Maybe you've won that patient over by learning about them. Because again, at the end of the day, this is about patient care. It's not about acquiescing to a PPO plan. Mm-hmm. Saying things like you're due for x-rays. It makes it sound like the insurance company is dictating that. We need to take x-rays every so often, or we need to perio chart every so often so that your insurance company has this information. We're telling our patients that the reason why we're gathering these assessments is for the insurance company. Is that true? Is that accurate? Of course not. The reason why we're taking these assessments, or the reason why we should be taking these assessments, is because we need this information to better guide our clinical decision making.
I'm going to chime in here real quick.
Yeah,
so I love the example that you just used, because this is a great topic for the exercise to take place, but this we can take this lesson and apply it to any aspect of dentistry and really any aspect of life, and that is the power of semantics, right? So yes. I'm going to say something to you, and you're going to have an interpretation of that, and mm-hmm. it's going to be what you hear and how you feel. So here's the exercise. You ready? So yeah. The dog bit Johnny. Right? So the dog bit Johnny. We can interpret that one way. Or I could say the same thing and say Johnny bit the dog. and it's going to have a completely different meaning and experience. And I
Yeah.
love what you just did in highlighting that, because you can say it with the right intention to the patient, but the way that you're saying it,
Mm-hmm.
they're automatically interpreting it the way that they're going to want to interpret
Yeah.
without giving you a chance. And so being aware of how we're saying those things, on the x-rays, right? Oh, 6 months is due. You're due. You have two x-rays. Your insurance will cover 2 x-rays every year, or every
Right.
3 years, or every 2 years, or whatever the policy is. Totally different experience when you say it like that. So anyways, I
Yeah.
love it.
Yeah. No, thank you. And you're so right. I think that's the issue, is that, again, we don't realize from semantic standpoint that we're even threading our conversation with that. I think
mm,
we're doing it innocently. I think we're doing it
yeah.
because if we say like, oh, don't worry, your insurance covers it, then the patient isn't going to ask more questions. But why is that our number one concern? Why is it not, these are areas that doctors actively monitoring, or I'm going to expose these images to be able to see your bone level, to see this in between your teeth? That should be the number one concern, not your insurance covers it, so let's get started.
Mm-hmm.
Um, and so I think that's a huge layer to this. I think when we look at insurance compliance, the number one thing that we look at is the fact that we believe the patient has financial concerns. And, dentistry is daunting. It is not inexpensive. I have 4 dogs. You're hearing one, by the way. He's, if you hear some background noise, my oldest dog, Darby, is snoring. So please forgive the background noise if you hear some snores. But
Snore away, Darby.
that's right. Yeah.
I
Keep
hope you're having
snoozing.
good dreams.
I know. Keep snoozing, Darby. But I have 4 dogs, and they're all smaller dogs, and it never fails. I take them in for their dental cleanings, and this one needs this extraction. This one needs, well, it's always something. It's not cheap, even in the veterinary dental world.
Mm.
And it's certainly not, inexpensive, the work that we do. The challenge for us is, how do you take the work that we do and you advise the patient that this is essential work for the most part, or this is work that needs to be done to help support the patient in excellence, and let them know that really, although there are financial concerns, what we're concerned about is your overall health, wellness, and vitality. And so I think the initial layer for a lot of us from a perception standpoint is that when a patient is adhering to their insurance, or they're saying, does my insurance cover that? Or I'm concerned about my insurance coverage on this, is the financial piece of it. But I think more so the issue is maximizing benefits. And I think that's the piece that we need to take a look at. The conversation that I have with patients that for whatever reason puts them at ease is, I'm not sure. Now, I will tell you, my patients actually don't know that my patients don't know that I travel nationally and internationally talking about CDT codes and insurance coverage and maximizing benefits. They don't know that. All they know is I just spent a long time assessing what's going on in their mouth. And so when the patient asks me, which I do get in my practice, does my insurance cover that? My initial response to that patient is actually, I don't know. And I play the dumb card, Jerem. I do, and I do it very well. But I tell the patient, I don't know. I let the patient know, in our practice, we have a team of financial advisors. We have a team of treatment coordinators that have spent time researching your insurance. Do you see what I'm doing here? That are researching your insurance. These people are dedicated to doing everything they can to maximize your benefits to the best of our ability.
So good.
However, right? I mean, they need to know that because we all do that. We're all researching. We're all gathering this information, sitting on the phone, representative. We're doing the whole thing, right?
Yeah.
Our patients need to know that. And sometimes I think we diminish that. And the other layer to it is, I tell my patient, I am purposely not told in the back. I am told, but go with me on this. I'm purposely not told what your insurance will or will not cover, because we believe in this practice that my job is to tell you about the treatment you need to get yourself back to a state of health. So my job is to talk to you about what you need to get healthy, and your treatment coordinator's job is to find the best way to work their magic and make it happen for you from a financial standpoint. What I've done as a clinician is I have advised my patient that what I care about most is your health, wellness, and vitality. And by the way, what we care about is you. And we're going to work with your, insurance company. We're going to do the best we can. But at the end of the day, that doesn't change your treatment plan. That doesn't change the fact that your Delta Dental or your Blue Cross Blue Shield or your Humana does or does not cover this. Doesn't change the fact that, by the way, sir, you have infection, and that infection needs to be treated. What it comes down to is the core value of veracity, fairness, and treating every patient with the same level of excellence. Not, well, you get x-rays every 12 months because your insurance covers it, but you get x-rays every 6 months because your insurance covers this. That's a core value that at the end of the day, it is creating, again, layers where we are far more dependent on the insurance than I think our patients are. Ultimately, I think we need to take a step back and we need to take a look at what the value system is for our patients. Yes, I think they come in and their initial concern is insurance, insurance, insurance. But we need to have strategies in place. We need to have a better communication piece for our patients so that they understand we are a dental practice first and foremost, and our role is to helping address our patients' needs. The secondary piece of that is that you have this, small little debit card with a couple grand on it that we can try to use, and we're going to do the best we can. By the way, dentistry, that means you need to take diagnostic x-rays. You need to take x-rays that show the bone level. You need to take vertical bite wings to show that bone. You need to take bite wings that don't show overlap. You need to utilize paralleling technique to gather appropriate assessments. We need to use the appropriate diagnostics, comprehensive periodontal charting, comprehensive imaging to evaluate decay, risk assessment pieces to help our patients better understand that these are the concerns that we're seeing in your mouth. And we want to be able to drive that home. Our value system needs to be patient-centric, not insurance-centric. And the final parting piece that I'll share before I open the floor up to you, because I know that this is one of your favorite topics, are the basic considerations when it comes to PPO. So consider renegotiating your fees. You should be renegotiating your fees, and you should be renegotiating your contracts every few years with your third-party payers. We know that fees should be increasing based on what we know about the various increases in cost of living, for example. We know that we need to be looking at some offices, for example, cannot bill out the 4346 procedural code because they haven't renegotiated their contracts since that code has been out. So there are things that we need to do in dentistry from a communication standpoint to hold our PPO third-party payers to a higher standard of excellence as well. Again, Jeremy, I want to thank you so much, as always, for the opportunity to hang out with you and to talk about your favorite topic, PPO dependency. It's been an absolute pleasure. If anybody has any questions for me or anything that I can do to support you, please feel free to reach out to me. You can find me online, www.katrinasanders.com. You can email me, katrina@katrinasanders.com, or feel free to always find me on social media. Jeremy, it's been a pleasure.
Oh gosh, Katrina, thank you so much. And yes, it is one of my favorite. I'm still learning a lot about it. However, the reason it is because it is a source of payment to the practice. And when we're talking about the profitability of the practice, one, we can talk patient care, and that should be at the center of our success all the time. That should never change. But if we're not running a good business, then we can't provide the best patient care. And so when I look at the revenue and where we can collect coming in, the reason I like this is because, and you kind of hinted at this, in my experience, one, very few practices are going back to negotiate, right? They just keep going, and they don't understand maybe the power they have in negotiating. And then the second to that is not a lot of practices will do a fee assessment.
Right.
They don't raise their prices, and they don't, and that should be that shouldn't be an uncomfortable topic.
Right.
Because if the cost of living is going up and your prices as a dental professional stay the same, you're out of business. You're just not going to survive, because the cost of living didn't just go up for them, it went up for everybody. And so looking at your fees and knowing the last time that you negotiated with those insurance companies, that gives you leverage. I mean, multiple practice management softwares and the data that, I mean, Dental Intel can easily provide this. And that is historically who have been our top insurance companies, who are our patient base using the most. Every area is different. What are the codes that are being used the most within those claims? And let's go negotiate. I mean, that's just the simple, like, basic side of it. But the topic is profound and very important, as it is an income source of payment to the practice. So thank you for preparing that and your thoughts and your expertise. We appreciate you, the core group, and obviously the value that you are constantly providing. Guys, for those that are watching, I highly encourage you. One, I have this phrase, I tell this to my kids all the time. In my management experience, it's something that I constantly have used, and that is, what you tune into, you turn into. And I highly recommend you tune into Katrina. She's got a slide right here with her contact information, her social media. What we've talked about, even just in this one video, there's a lot of details there. But as you're tuning into it, and you're constantly tuning into it, you'll turn into it. You'll eventually see the adjustments that you need to make as a professional to optimize the patient experience and the practice. So on behalf of Dental Intel, to you, Katrina, thank you so very much.
Thank you.
And for all of our viewers, thank you once again for joining us today. We hope that you walked away with a little nugget there that will only help you realize your potential as a dental professional. So with that being said, once again, thanks, Katrina, and to all of you guys, thank you for joining us. We'll see you. Okay.